can a CT scan decrease your chances of having a heart attack? Stay tuned. Hey there, Dr. Perry here from Lightbox, where we shed light on all things radiology to empower you on your journey to better health. For those of you that are new here, I'm Dr. Perry Coronary, a board-certified neuroradiologist and patient advocate. Here's a link to my bio, and I want to simplify the world of medical imaging in a way that everyone can understand. Be sure to like and subscribe and to hit that notification bell so you'll be notified as soon as we drop new content. Today we're going to talk about coronary CT angiograms. What are they and who needs them? To find out, we're going to hear from Paul in Boston, who writes, I'm 56 years old and my doctor wants me to get a coronary CT angiogram because I sometimes experience chest pain and shortness of breath while exercising. She mentioned that the test may involve AI. What is a coronary CT angiogram? What will the results tell my doctor, and how would AI help? So without knowing any additional information, it sounds like Paul's doctor has asked him some standard questions, performed a physical exam, discussed his risk factors, and maybe even performed other basic tests like an EKG as a start. Now she probably wants to know whether or not his symptoms are due to coronary artery disease. But what exactly is that? The coronary arteries are blood vessels that supply blood and oxygen to the heart. Over time, these arteries can become narrowed or blocked due to plaque accumulation, which is basically an abnormal buildup of fat, cholesterol, and calcium along the inner walls of the arteries. When plaque builds up inside the coronary arteries, blood flow to the heart decreases, causing symptoms like chest pain, shortness of breath, and potentially even a life-threatening heart attack. So one of the main goals of radiology in evaluating people with chest pain is to get a detailed look at those coronary arteries to see if the buildup of plaque is the cause of their symptoms. And that information helps doctors determine the best treatment plan for you, which may include lifestyle changes, medications, or a therapeutic procedure called balloon angioplasty with stent placement to help open up those narrowed vessels. In some severe cases, cardiac bypass surgery may be the best option. Now, before CT scanners became so advanced, the primary way for doctors to detect plaque in the coronary arteries was by performing a coronary angiogram, also referred to as a cardiac catheterization. During a coronary angiogram, the doctor inserts a long, thin catheter into an artery in the wrist or groin, and then carefully advances it inside the body until it reaches the heart. Once the catheter tip is in the right position, the doctor then injects X-ray dye, also known as IV contrast, into the heart while it's beating in order to get real-time X-ray images of the coronary arteries like this. Now, coronary angiography has always been an excellent way to detect plaque and determine how much blood vessel narrowing there might be. And depending upon the amount of narrowing, coronary angiograms also give doctors the ability to calculate something called FFR, which stands for fractional flow reserve. Now, we're not going to bore you with all the technical details about pressure gradients and fluid resistance, but just know that this FFR value basically tells doctors how well blood is flowing through narrowed arteries and whether or not those arteries would benefit from being widened by a procedure called balloon angioplasty with stent placement. To better understand how FFR evaluates blood flow, think of traffic flowing on a highway. On the left, you've got 3 slow lanes of cars trying to squeeze into one lane in order to get around the debris on the side of the road. The cars on the left are moving much slower than the ones on the right, where traffic is flowing fast and smooth because all the lanes are wide open. Now, there are definitely more nuances to FFR, but those are well beyond the scope of this video, but that's the basic premise. Now, coronary angiography is a safe and effective procedure that provides doctors with a lot of valuable information, but there are definitely a few expected drawbacks you should be aware of. As with any procedure that involves injecting IV contrast into blood vessels, there's always a small risk of bleeding, infection, damage to the blood vessels, or an allergic reaction to the IV contrast. Other drawbacks of coronary angiography include more preparation time, longer procedure time, and a longer recovery period, which is usually a couple hours, but may sometimes require an overnight stay in the hospital. Now, despite all these expected drawbacks, doctors may still recommend a coronary angiogram depending on your exact situation and risk factors, because that test has the added advantage of giving doctors an opportunity to treat narrowed vessels right there during the test by performing a balloon angioplasty and placing a stent. And for those reasons, coronary angiograms still play an important role in the diagnosis and treatment of high-risk patients with heart disease. But for certain individuals, there are other effective ways to evaluate the coronary arteries. For many people, a coronary CT angiogram, also known as a coronary CTA or CCTA, can be a quick, reliable, and non-invasive alternative to traditional coronary angiograms. But what exactly is a coronary CTA? It's basically a specialized type of CT scan that creates high-resolution 2D and 3D pictures of your heart and coronary arteries, and it provides a lot of the same information as a traditional coronary angiogram, but in less time and without all the added risks of an invasive procedure. In a lot of ways, this type of CT has become a game changer in the way doctors evaluate patients with typical and atypical chest pain. Now, I need to stress that unlike a traditional coronary angiogram, a coronary CT angiogram is only a diagnostic test. In other words, if the CT angiogram shows that there are narrowed coronary arteries that need to be widened with a stent, that procedure would have to be performed at a later time. Also, coronary CTAs without AI software can't calculate that FFR value we talked about to determine how well blood is flowing through narrowed vessels. Regardless, a coronary CTA can still provide a lot of valuable information that could explain the cause of your symptoms and help doctors determine the best treatment plan for you. So how exactly is a coronary CTA performed? After your doctor provides you with a request, you need to schedule the test at a medical imaging center. When you check in at the time of your appointment, you'll fill out some basic paperwork about your medical history. Be sure to mention any allergies or kidney disease you may have because the IV contrast you'll receive during the test could potentially cause an allergic reaction or damage to unhealthy kidneys. Before the scan, you'll be hooked up to a special type of EKG to monitor your heart rate, and they'll place a small IV line in your arm. When you're ready for the test, a tech will take you back to the CT scanner and ask you to lay on a padded table that slides in and out of the scanner. Just before the scan starts, a small volume of IV contrast will be injected into that IV in your arm, and as that liquid flows from your arm into your heart, the scanner will start taking special X-ray images that produce very detailed pictures of your heart and coronary arteries that look like this. Now remember, your heart is beating throughout the entire scan, and for that reason, the X-ray images are timed in a way that matches your heartbeat. So if your heart is beating way too fast like this, you may be given an oral medication called a beta blocker to safely lower your heart rate so it sounds more like this. And that slower heart rate will allow for a much better scan. They may even give you an oral medication called nitroglycerin to safely dilate your coronary arteries and make them more visible. The entire scan lasts about 30 minutes or so, including prep time. Once the test is complete and you're feeling well, they'll remove the IV and heart monitor and you'll be free to go home. The main risk of coronary CTA is an allergic reaction to the IV contrast, but if you do have an allergic reaction, it's usually mild in the form of a skin rash, itching, or sneezing. So if you do have an existing contrast allergy that you're aware of, it's extremely important to mention that when you schedule your test, because you might need pre-medication prior to the scan to minimize any risk of a potential allergic reaction. Now, everyone's talking about AI in healthcare, and as a radiologist, I'm super excited to see how AI has the potential to improve all types of medical imaging, including coronary CT angiograms. But how exactly does AI help that kind of scan? So there are several companies out there that have developed AI software that helps doctors detect and quantify coronary artery plaque, and that kind of technology helps doctors provide more accurate and consistent interpretations of coronary CTAs. But what's even more interesting is that some of this AI-powered software enables doctors to take a more detailed look inside the plaque to see what it's made of. But why is that such a big deal? It's because the composition of the plaque often determines how deadly it might be in the future. Terms like lipid-rich necrotic cores, intraplaque hemorrhage, and fibrous caps are way beyond the scope of this video. But the important takeaway is that knowing what the plaque is made of can help doctors determine which plaques are more likely to rupture and cause a heart attack in the future. And that information can help doctors make more informed decisions about what treatment options are best for you. But there's even more that AI can do. The other neat thing is that some types of AI software can calculate that important FFR value we talked about earlier, without needing to stick a catheter in your heart during an invasive coronary angiogram. In other words, a coronary CT angiogram performed with certain types of AI software can give doctors a quick and non-invasive way to assess how well blood is flowing through narrowed vessels in order to determine which vessels need to be treated. And some early studies have shown that depending on patient risk factors, coronary CTA enhanced with AI could potentially improve patient outcomes, reduce unnecessary testing, and help doctors better identify which patients would benefit from therapeutic interventions like stent placement. Bottom line is that AI is here to stay, and it has the potential to improve patient care and save lives by redefining how doctors evaluate patients with chest pain. Now, should you ask your doctor if you need a coronary CT angiogram? If you're experiencing symptoms like chest pain or shortness of breath, or if you have a family history of heart disease, it's definitely worth seeing your doctor and having that conversation. After assessing your risk factors and performing a clinical evaluation, they'll determine if a coronary CTA is appropriate for you. It's also worth asking your doctor if they think your coronary CTA would benefit from the added AI technology we touched upon. So if your doctor has already provided you with a request for a coronary CTA with or without AI, please click the link below to schedule your test at an imaging center near you. If you just want to learn more about AI for coronary CTA, we've got those links as well. Thanks for watching. Keep asking great questions. Stay healthy, and we'll see you next time.